Hi, everyone, and welcome to this month's Tumolo Talk. I'm Ken Tumolo, and I have Alyssa Tumolo with me today. She specializes in Medicare, and we figured that this would be a good topic for this month's Tumolo Talk, Medicare, since it's Medicare time. So I'm going to turn it over to Alyssa. Go ahead, Alyssa.
Hi, thank you. I'm really excited that we are bringing Medicare solutions to Tumolo Financial, and that we're able to offer them here. And I know Medicare can get very confusing, so I'm hoping that I can just answer some general questions today. And then if you have any questions, I'm here, so feel free to give us a call, or you can schedule an appointment with me, and we'll get to that later. So here, we'll start with some general information. So we'll start with when you're eligible to join Medicare. So there's a couple different criteria, but the main one is you're 65 years old. There is an exception to that, and that's if you have a disability or other special situation. And then you also have to be a U.S. citizen or a legal resident and have lived in the U.S. for at least 5 consecutive years. So when can you sign up for Medicare? So there's different enrollment periods, which are shown right here. And I'm just going to touch on a few. So the initial enrollment period, I'm sure you're familiar with that. So that's when you turn 65. And that's a 7-month period. So it starts 3 months before you turn 65. It's your birthday month. And then it's the 3 months after your birthday month. And then another big enrollment period, really the main one where you'll see all the commercials and everything like that, is the annual enrollment period. And we are in that right now. So that's every year from October 15th to December 7th. And you can change your plans as you like. You can sign up at that time. So we're in that enrollment period right now. So there's also a couple other ones, and special enrollment period means maybe you just left your job and you don't have group coverage anymore. That's a special enrollment period. You'll get some time to enroll after you drop that coverage. So here are the different parts of Medicare. So original Medicare is also known as Part A and Part B. Part A is your hospital insurance. Part B is your medical insurance. There's also additional coverage options offered by private insurance companies. So you have Medicare Supplements, Part D, drug coverage, or Part C, Medicare Advantage. So we'll break those down a little more. Part A is your hospital insurance. So this really provides coverage for inpatient hospital care, skilled nursing facilities, hospice. And the thing to really note about Part A is that as long as you have creditable quarters that you've worked in your lifetime, then your Part A premium will be $0. So most people that worked for a good amount of their life are eligible for Part A. And if you need some clarification on that, you can call the office or send me an email, and I can go over that with you. But so for most people, Part A is free. And that's your hospital coverage. Now, Part B, on the other hand, most people, unless you're Medicaid eligible, most people have to pay a premium for Part B. And that's really the meat and potatoes of your health insurance coverage. So that's your doctor's visits, your outpatient surgery, x-rays, emergency care, urgent care. So that really is why you're paying a premium most of the time, is because that's what you're going to use on a day-to-day basis, or, more often than hospital coverage, hopefully. So Part B premium costs, as you can see, they're by income. So I'll just keep this up here for a moment so you can take a look. And you can kind of see this is for 2023, what you would pay in 2023, and it's by your tax return. Now, Part B does have a late enrollment penalty, so this is something to plan for and to think about. If you do not sign up for Part B when you're first eligible and not covered by an employer plan, you may have to pay a late enrollment penalty. So I'll give you an example. So if today I turn 65 and I say I decline Part B coverage, and then 3 years down the line, I decide, oh, I do want Part B coverage, then I will have to pay a penalty for every 12-month period or every year that I was eligible for Part B but did not enroll. So that would be 3 years of penalty. So it's 10% per year. I would have a 30% penalty on the monthly premium that I have to pay for the duration of my Part B coverage. So as that penalty doesn't go away. So as long as I'm covered under Part B, I pay that penalty on top of my premium. So we really don't want to have to deal with that. So make sure you plan for it. And there is an exception if you have creditable coverage under your employer or group plan, then you won't be subject to a penalty. So that's also something that we can go over and make sure you're covered for that. So Medicare Supplements. So these are by private insurance companies, but all plans are the same with Medicare Supplements. So they're different letters of the alphabet. I'm sure you've heard of Plan F or Plan G, things like that. But every Plan F and Plan G are the same. They have the same benefits no matter what company you're with. It's a federally mandated program. So just make sure the only thing that differs is the cost. So that's something you definitely want to look at when looking for a Medicare supplement plan. These can cover deductibles, co-pays, co-insurance, and these are also known as Medigap plans. So they fill in the gaps that original Medicare coverage doesn't cover. A good thing about that is you have freedom to choose any Medicare appointed doctor in the US since it's a federal plan. And it does vary based on your zip code. So Part D, or prescription drug coverage. So once again, there's two different types of Part D coverage. You can have a standalone prescription drug coverage plan, or a lot of times they're integrated with a Medicare Advantage plan, which we'll get to in a moment. But in order to have Part D coverage, you must be enrolled in Part A and or Part B. So you don't need both, but you do need one. And you have to live within the plan service area. So again, it's based on county. And this provides coverage for some of your prescription drug costs. So it's important that, when you come in, we look at what prescriptions are you on, and we find a plan that covers those prescriptions. So again, that's something that can be tailored to you, and we make sure we find the right plan for you. Again, late enrollment penalty. So just like with Part B, there is a late enrollment penalty if you do not sign up for Part B when you're Part D, when you're first eligible. And unless you have creditable coverage like a group policy. So the monthly premium will have a penalty of 1% of the national base premium, which is $32.74 in 2023. And that will be multiplied by a number of full uncovered months you were eligible. So again, something else to be aware of. Part C, Medicare Advantage plans. So Part C combines Parts A and B. And like I said before, it can include Part D coverage, prescription drug coverage. And these are also known as Medicare Advantage plans. So these come in all different types of plans. They can be an HMO, a PPO, and sometimes you need a primary care physician to refer you to specialists. Sometimes you don't. So it's really, we look at what your needs are, what you look for in your health coverage, and we go from there. And again, if you need prescription drug coverage, if you don't. So these are really based on your needs. So if you are interested in a Medicare Advantage plan or a Medicare Supplement plan, or you just have general Medicare questions, talk to me. So that brings us to how we can help. So you can call me at the office. Again, my name's Alyssa. So the number's right there, and that's complimentary. I'm not just like Ken. I'm not going to charge you to answer questions. I want to help you. Or you can come in and set up an appointment in our office or over Zoom. I will go to the Middletown or the East Lyme office, so we can set some time up there. And also subscribe to additional Tumolo Talk videos on our website. You can subscribe so that you get them every month. So thank you so much for tuning in. I hope to talk to you soon, and I hope that helped clarify some things. So thank you. Have a great day.